Hello friends, this is Dr. Sangram Patil. Friends, as you know, we in modern medicine talk about cells and atoms and molecules when we talk of the disease and its management. Same applies to the COVID-19. The COVID virus has been seen under electron microscope, and the medical scientists all over the world are looking at the ways how COVID affects the human cells and how the medicines can be used to stop the spread and multiplication of the virus. The modern medicine believes in evidences, and there's a lot of talk about grades of evidences based on the quality of the research which is conducted. The grades of evidence are divided into 5 grades, and I would go through it quickly. Grade 1 is a systematic review or analysis of lot of different good quality studies published in different medical journals. And these studies have to be randomized double-blind control trials. In simple words, randomized double-blind control trial means the patients are randomized into 2 groups, and the person who treats and the person who makes notes observations of the patients, they are unaware of what treatment each group is receiving. Not only this, but the patients in these groups don't know what they are getting, whether it is an active medicine or it is just a standard care with or without placebo. And based on these trials, the evidences are grade 1 if you have collection of few randomized double-blind control trials included in the analysis. If you haven't got many of them, but 1 or 2 good quality randomized double-blind control trials, they will form grade 2 evidence. If you for some reason cannot randomize or do blinding of the groups or observers, then good quality study of this sort makes grade 3. And grade 4 is when there is a group or series of cases where a direct relationship can be established between a medicine and a disease. Then such a study gives rise to grade 4 evidence. Grade 5 evidence comes from an expert opinion from the scientists or the authorities who actually treat these patients, or such bodies and organizations which have known reputation and they have these expert people working with them. If they opine that certain medication or treatment can be useful in COVID-19 or other disease, then it is taken as grade 5. So it is the lowest quality of evidence. Now, let us consider Patanjali, which is the maker of Ayurvedic pharmaceutical products as well as few beauty products in India. Now, who are Ramdev and Balakrishna? Are these trained Ayurveda doctors? Are they MD? No, they are not. They are not highly qualified people in Ayurveda. Second thing is, are they qualified to conduct research in Ayurveda or in any medical faculty? Do they have MPhil or PhD degrees? No, they haven't. So who are they? They are the owners of this pharmaceutical company, which is an Ayurvedic company basically. So maximum they can be spokespersons or CEOs of this company and they can speak on their behalf. They don't even work for any Ayurveda research type organization as an expert, which is known nationally or internationally. So we cannot consider them as an expert people. So their opinion is the opinion of their private firm which produces Ayurvedic medicines. It cannot be even taken as grade 5. Forget about grade 1 to 4, which is based on very high quality patient related studies, as I just explained. Let us look into the previous claims Ramdev and Balakrishna have made with regards to what services they offer. So they have been teaching people yoga, pranayama, and they have been selling Ayurvedic products through their firm. Now, their claims, what I have heard on various YouTube videos and programs which I have attended in past in India, they claimed to have preventive and curative role for yoga, pranayam, and the medicines they sell through Patanjali. They claimed that the medicines were useful in curing and preventing cancers, heart and lung diseases, kidney and brain diseases. If you look at the literature nationally or internationally, there is not a single study known to me in any literature, in a scientific literature, which talks about any double-blind control trial or even a good quality case series, case cohort study published by Patanjali, which is based on their medications. So they haven't got a good quality scientific evidence in modern medicine in this age to say that they have authenticity to comment on treatment for COVID-19. Now let's talk about COVID-19 and their claim about the treatment of COVID-19. Now I looked at the TV channels and few media news from India regarding this, which were produced few days back. Now they are talking about having 100% result in treating people who have COVID-19 test positive. Now this claim itself is illogical. Having 100% positive result for any medication is extremely unlikely claim in medicine, which itself is a wrong claim. Now second thing is what I have heard Balakrishna saying that their medicines have converted 70 to 80% of the people from COVID positive to COVID negative in about 12 days. They've also said that in a couple of weeks, all of them have become negative. Now, friends, when someone is infected with COVID, more than 90% of such population will not develop any symptoms. And this I'm talking based on the antibody testing results from various communities all over the world, including America, Sweden, and also ICMR, which is an Indian organization, its study done in various districts in India. Now, people who develop symptoms from COVID, 80% of them will be mild and 15% will be moderate and 5% will become serious. Now, mild and moderate symptom people, they will recover naturally without any treatment or just a little bit of support from medical team. And severe patients will need more aggressive therapy. Some of them might need intensive care and 1 or 2% of people might die, depending on the comorbidities and their age. Now, what Balakrishna is talking is the recovery of these mild to moderate people, which recover naturally anyway. And their tests become negative in 2 to 3 weeks naturally anyway. So, what he is talking is a natural recovery. There is no direct correlation between their medication and patients getting better. I'm not sure whether they are also studying these medications in critically ill patients, which will be very interesting area to see if their medications are helpful for critically ill patients to come out. But again, this will be a complicated, complex type of study which will involve a very thorough comparison of two different groups, in which one group would have received their medication, the second group will receive the standard care. My next point is, will this Patanjali claim be published in any good quality peer-reviewed medical journal? I highly doubt. Peer-reviewed journals do publish poor quality studies, but they are not interested in such media-led claims. they need some kind of basic, well-structured, well-designed studies for consideration to be published in peer-reviewed journals. And apart from Indian media, I suspect if any of the medical literature, medical resources will even consider publishing the study which has been talked in media in India. My next point is, whenever pharmaceutical firm does any clinical trial in patients, especially phase 3 trial, it involves many hospitals and hundreds or even thousands of patients. And the patients are not chosen by pharmaceutical firms, and the studies are done by the medical teams, and medical teams administer and they observe the results and effects of the interventions or medicines. Whereas here, in case of Patanjali, they are the drug makers, they are the decision makers, and now they are analyzing and declaring the results. So this is completely a private pharmaceutical company study, and now they are declaring it in a media as a breaking news, instead of declaring their detailed data, patients, study design, patient inclusion, exclusion criteria, and what parameters they studied, what were the final outcomes. People would have believed them if they had given these study details, which makes me feel doubtful about their intentions, especially if we look at the history of Ramdev Baba and Balkrishna. Their claim is to have preventive and curative effect of yoga and their medicines for everyone in various diseases. But if you look at what happened when Ramdev and Balkrishna actually got seriously ill, their products and their asanas and their pranayamas, they didn't prevent illness in these guys, and their products didn't help them to get rid of the disease. They had to rush to the hospitals and take help of modern medicine. Now, I have no objection for them to do so. The life is more important than which pathy of medical faculty you use. But what they had claimed wasn't even true for them. I do not want to speak about their political stand and their stand on black money and corruption and getting the oil and diesel prices down in India after 2014. But what I want to speak on is their propaganda to promote Swadeshi, which is made in India stuff. Now, these people have opposed noodles directly and indirectly through their Swadeshi movements. They have opposed jeans. I have heard Ramdev Baba talking so much against jeans, and now Patanjali has launched their own jeans and they have launched their own noodles. So propaganda for Swadeshi, made in India products, is not for the sake of country. It is just to exploit people's emotions, to defame multinational products and then introduce their own products. So looking at this history of Patanjali, Ramdev and Balkrishna, I have few reservations in this regard, and I would like to go through the details of the study they have conducted. I would like to go through all the patient scenarios and patient outcomes and the protocols they use to treat the patients, and then make my decision what grade of evidence this could be, and then make a decision whether this is going to help my patients or help myself. And I would suggest everyone to actually think logically and make a decision and not rush to get any products which are being advertised through breaking news or social media. Like we rushed for some homeopathic medication or Ayurvedic kadha and also allopathic chloroquine. So we don't want to land up in that anxiety or panic situation where people exploit our fear, exploit the uncertainty, and use this opportunity to sell their products. So my take on this breaking media news about Patanjali medicine being 100% effective in the management of COVID-19 will be to just wait for the detailed study publication, go through the study, check for the quality of the study, and the quality of the evidence it gives us, and then make a decision whether it is appropriate to accept their claim. But at the moment, some people who make medications claiming that their medication is 100% effective for cure of COVID doesn't stand as an evidence in modern medicine. So we'll have to be logical and just wait for more evidence. Friends, if you do agree, do share and take care. Best of luck. Bye bye.